Hello everyone, my name is Jenny. Because I don't have any work experience, so today I would like to present this topic called leadership in the emergency department. And the reason why I just would like to present that is because I only have some, student nurse experience, and one is just in the emergency department. I think the leadership in their emergency departments is very crucial because they have to make sure everything rapidly and ensure that just complete, yeah, imperfect. So I just divide into three parts. First is the situation from Taiwan. Second is leadership theory, and the third is empowerment. And I just in brief way to share about the situation from Taiwan. Taiwan has the shortage of nurses, so the leaders just take the responsibility for anything because the nurse is very new. They don't familiar with everything. Okay. So I think I would just say that in Taiwan, their leadership theory just based on authentic theory, because authentic leadership is really transparent, and uh, you know I think the leadership just in Taiwan like just often just take responsibility for their co-workers and encourage them, and with an open-minded to share their knowledge in just keep the situations, keep every patient safe. Yeah. So I think that the work really hard and often over time without extra theory. And I just find some research reference to prove that my idea about the authentic. Sorry, I found one interesting reference just talk about the authentic theory. First, the author just tried to put the leadership theory as an authentic theory into practice because one place the nurse feel burnout because they don't have any theory best to promote and take into practice. However, the result is very shocking because the results show that there are more burnouts when they start to conduct this authentic leadership theory. So this is the drawbacks. However, I just found that different reference just about that. Some, I think I found a lot of reference just talk about authentic. So leadership theory is very good, and that can just create positive effects in the health system. And besides, I would say that it just create some positive outcomes such as job satisfaction, structural empowerment, areas of work life, positive work group relationship, and trust. Besides, some study also present that authentic leadership theory can positively facilitate nurse engagement, job satisfaction, retentions, and organizational commitment. Yeah. So I would say that both have benefits and drawbacks. However, I think this study, because first is experimental study and second is RCT, and the third, I just found a lot of evidence. So include systematic reviews. I think they have a lot of internal and external bias. So I cannot complete to say, to say one result. Yeah. So another I wanted to show the professors is, the empowerment. Why I would like to choose this topic because when I was a student in my university, I really often to, listen these words, but it's hard to take in practice because I think it's abstract. My teachers often tell me that structural improvement, but they don't have a, some specific term to say that. So I just found everybody know empowerment is empower for nurses and also patients and their family because it's very crucial thing that can reduce some risk of hospitalizations because they have to make sure that out of hospital they have to not have any skills to care about them. However, I think that it's I found some recent reference is very funny. It's about just talk about the different categories about of empowerment. First is structural empowerment, second psychological empowerment. I think it's very funny because first structural empowerment just I often heard and just include some substantive resources, support, information, jobs, and so on. And psychological empowerment include four dimensions: meaning, competence, self-determination, and impact. I just saw a research is about uh, the the leadership in emergency departments. They just they just give them some questionnaire, but they think that are well in empowerment or not, and all of them just present maybe 95% of they are very compliment their leadership is really empower something and such. However, I just found them the different dimensions of structural empowerment and psychological empowerment. It's really lingual. They cannot define that whether what is structural, what is psychological. Yeah. So I think they are too competent to, to just make sure everything is just in empowerment or not. Yeah. So in conclusions, in my point, I think that if in the future they can just use empowerment and also, I think almost every leadership just signified about empowerment, but whether they have comprehensively definition of that or take into practice in a clinical way, they're really into this. I am not sure about that. So thank you. I finished my report. Yeah. Bye bye.